Okay, sir, my name is Nancy and I'm going to do an abdominal examination on you. Is it okay if we put it on YouTube when we're done?
Yes.
Okay, thank you. Okay, so the first thing I'm going to have you do is lay down and get comfortable. Okay, you're going to get your feet there, good. And then I'm just going to ask you to bring your t-shirt up so I can see your abdomen. I think everything is good. Okay, so now I'm going to adjust the camera. Okay, well you can't see my... Okay, so the first thing I'm going to do is just look at the abdomen. I'm looking at the contour of the abdomen. I'm looking to see, is it round? Is it flat? Is it protuberant? Do I see any of peristalsis movement? No, I don't. Okay? Now I'm going to look at the sclera. Can you open your white eyes big? Okay, and look over there. Okay. I'm looking at the sclera and the overall color of the skin to check for jaundice. Negative, the patient's skin color is appropriate for his race. Okay, now I'm going to go ahead and listen. I'm going to listen to all 4 quadrants of the abdomen. I'm listening for bowel sounds, and bowel sounds are good. And we want to hear if it's measured out 5 to 30 a minute. And the sound of the bowels making a sound is the actual peristalsis contraction of the colon moving the stool forward. So I'm going to go ahead and listen now. I'm going to start with the right lower quadrant. Bowel sounds heard. Bowel sounds heard. Okay, positive bowel sounds in all 4 quadrants. Now I'm going to listen to the arteries of the abdomen. We're going to listen to the aorta, the renal, iliac, and femoral arteries. I'm going to listen for bruits, which is a positive test for atherosclerotic plaques, and that would have to be further investigated. So hopefully I won't hear any bruits. This is about where the aorta is. Okay. Renal arteries on the left, on the right, left. Iliac arteries. And now femoral artery. No bruits were auscultated, just bowel sounds. So that's good. Okay, so now I'm going to do some percussion. I'm going to percuss all 4 quadrants. Again, why am I doing this? I am going to listen. I'm going to either hear tympanic or dullness. Dullness is going to be over solid organs. Tympanic's going to be over hollow organs. So I'm going to start with the right lower quadrant. That's tympanic in all 4 quadrants. Now I'm going to try to determine the border of the liver. I'm going to start low. Okay, there's a little bit of dullness there, so I'm going to mark it with my pen. Okay, and then I'll continue to percuss. I'm going to start at the top in the intercostal area. There's That's solid there. So I'm going to make another, I meant to say dull because it's like over a solid area. Okay, so now I'm going to measure this span of the liver. It is 8.5 centimeters, which is within normal limits. Now I'm going to attempt to percuss the spleen, and hopefully I will not, because I shouldn't feel it. I shouldn't hear it. Tympanic all the way up to the rib area. If the spleen was enlarged, I would be able to feel dullness when I do the percussion here. Now I'm going to go ahead and percuss the bladder. I'm going to start at the umbilicus. Okay, I heard tympany in all areas, so that bladders should be empty based on the sound. Okay, so now I'm going to do light palpation. Light palpation can reveal mild tenderness, palpable masses, and rigidity. So I'm going to go with all 4 quadrants, starting with the right lower. This is just a light palpation. Okay, sir, if this hurts, let me know, okay? If I'm going to go a little harder, so if it hurts you, let me know, okay? Now this is a deeper palpation. Does that hurt? Okay. Okay, now I'm going to do a test to see if the liver is enlarged or tender. So I'm going to ask you to take a big, deep breath. And when I do that, when you do that, I'm going to push here. So when I count to 3, you take a big, deep breath. 1, 2, 3, deep breath. And release. Did that cause pain? Did that cause any pain?
No.
Okay, that's called the Murphy sign. If he had oh no, it's not the Murphy sign, it's just checking for an enlarged organ. Now I'm going to go ahead and do the same in the spleen area. Take a deep breath and out. Does that hurt? Okay, you can release your breath. Okay, so that's just checking for enlargement. Okay, now we'll go ahead and do some tests. I'll do the Murphy's test is to determine if the patient has any pain in the liver. So I'm going to actually, the Murphy's test is for cholecystitis. So I'm going to go to the mid-clavicular, come back down, and go right under the rib cage here. Okay? So I'm going to ask you to take another deep breath, as deep as you can. 1, 2, and 3. Does that hurt? Okay, so that's a negative for Murphy's sign. No cholecystitis, acute cholecystitis there. Okay, go ahead, breathe normally. Okay, the next one is to check for appendicitis. It's called McBurney's point. I need 2 landmarks. I need the umbilicus and the anterior superior iliac spine. So let me find that. Okay, it's right here. So here, so I'm going to go 2/3 from the umbilicus towards the ASIS, about right here, and then 1/3 from here towards the umbilicus, which would be right here. So this should be McBurney's point. Now I'm going to palpate deeply. Does that hurt, sir? Okay, so he's negative for appendicitis on that one. Now I'm going to verbalize a test. I'm going to sit down. Verbalize a test for ascites. I'm not going to do it because he doesn't have ascites. Okay, so to check for ascites, it's called the shift of dullness sign. I would percuss from the side, lateral side, all the way across to the other side. If the patient has ascites, it would be dull on the sides, tympanic on the top, dull on this side. Okay, so after I've determined that that's the case, then I would have the patient roll with his back toward me. So his back is toward me. I would feel the dependent side and percuss all the way up to this side, which is now up. If the patient has ascites, this dullness here shifts over to the top, and this will now sound dull, whereas this will sound tympanic, because this side is up and the dullness has shifted. And that would confirm ascites. Okay, the last test, the patient's going to have to sit down and I'm going to have to adjust the camera. So, sir, I'm going to ask you to scoot all the way down to sit at the edge of the bed. Yes, because I have to check your back. Okay, thank you. I think right here might be good. Okay, so if you can face, I'm going to need your back to be more toward the camera like this. Okay, so I'm going to do CVA tenderness, costovertebral angle. All right, so determine that first. Okay, the kidneys are right here, so I'm gonna, part of them do not have the ribs protecting them, and most of it does. So what I'm gonna do is put one hand here, and then I'm gonna, does that hurt?
No.
Okay, check the other side. Does that hurt?
No.
Okay, so that's good. If it did hurt, it could be kidney stones or polynephritis. Okay, so that concludes the abdominal test. Thank you.